Hi, I'm Margot Gray, and I'm going to be your PT today. This is my patient, Lauren Clark. Hi, Lauren. It's good to see you today. I'm going to be teaching you diaphragmatic breathing today. This is going to help you to learn how to breathe using your diaphragm. So what's going to happen with that is when you breathe with your diaphragm is located right here underneath your rib cage, and when you breathe in, your diaphragm is going to flatten out, and then when you exhale, it comes back in to underneath your ribs. Okay? So we're going to first start off with, I'm going to teach you how to learn where your diaphragm is. Sound good? So what I'm going to have you do first, do you mind if I put my hands on you?
No.
So I'm going to show you, your diaphragm is right here in between your ribs, right here. You want to go ahead and put one of your hands there so you can feel it? Okay? So what I'm going to have you do next, I'm going to have you put this hand up here on your chest, like that. Okay? So what I'm going to have you do, so you can learn where your diaphragm is and so you can feel what it feels like, I'm going to have you do a sniff for me, just like that, it's like you have a cold. What did that feel like?
I felt something kind of pop up right under my fingers.
That's great, that's great. That means that you felt your diaphragm. Your diaphragm was what was popping into your fingers when you sniffed. So we're going to go ahead and do that one more time, and then I'm going to watch your movement, okay? So go ahead and sniff for me. Great, that was really good. I noticed that your hand here was moving, and your hand up here was moving just a little bit. And the goal is here is that we want this hand to move, but we don't want this hand to move as much.
Okay.
Showing that we want to engage your diaphragm more, have more diaphragmatic breathing than your hand moving, which is more of your accessory muscles. So we want to focus more on the diaphragm.
Okay.
So I'm going to have you practice this in a mass practice without break. So I'm going to have you do 3 quick sniffs, and then we're going to have you exhale out, okay?
Okay.
So ready? So do 3. So ready? And then out. Breathe out. Great. How did that feel?
It felt good. I felt like I got a lot of air in.
You got a lot of air in. Okay, so we're going to go ahead and do that again, but I'm going to have you try and focus on not trying to let this hand move, okay? So do 3 quick sniffs for me again. And breathe out. Great. That was really great. You're doing a good job of making sure that this hand is moving and this one isn't. So I'm going to go ahead and show you another form of how you would normally get your diaphragm to move and have diaphragmatic breathing. So I'm just going to have you lay this hand flat for me. And then I'm going to go ahead and just have you do a really big, deep breath for me in through your stomach and a big exhale, okay? So I'll have you breathe in for me. Great. And then back out. Great. What did you feel in that? Did you feel, first your hands, which one moved more than the other?
I felt like my right hand moved more, but I did feel my left hand move a little bit.
And that's normal. That's great that I saw that this hand was moving, your lower hand, which is good that you're showing you're engaging your diaphragm and using your diaphragmatic muscles. So let's go ahead and do that 3 more times, just some deep breaths for me. Okay, go ahead and breathe in. Breathe out. That's great. I'm noticing this hand moving a little bit more, so let's go ahead and really focus on not letting this hand move and just this hand move, okay? Breathe in. Great, and back out. That's great. Okay, let's breathe in again. And back out. I noticed Lauren, you're doing a great job in making your bottom hand move and not your top hand. So this is basically what I'm teaching you for your diaphragmatic breathing, is to do this at home. We're going to transfer it to normal daily activities.
Okay.
So when you are brushing your teeth or brushing your hair, you can sit in the mirror and you can watch yourself put your hand on your ribs and watch your hand move up.
Okay.
And make sure you're engaging your diaphragm. Okay?
Okay.
So I'm also going to teach you an exercise that you can use to engage your diaphragm and do diaphragmatic breathing, the transfer test. So I'm going to have you do for that is have you sit on the edge of the table here. Okay? And for this exercise, what I'm going to have you do, I'll go ahead and show you.
Okay.
I'm going to have you bring your hands up, with breathing in really deep like you did before, and then back out, focusing on a good inhale and exhale, like you were doing before, engaging your diaphragm and using your diaphragmatic muscles, okay?
Okay.
All right, so go ahead and breathe in. Great, and then back down. That was very good. I noticed that your stomach was moving more, showing that you're using your diaphragm.
Okay.
And so what I want you to do is at home, go ahead and do this during the week, like try and do it 2 to 3 times a day, using your diaphragm.
Okay.
And then I'm going to have you come back in a week. I'm going to have you show me how you've been doing at home, and so we can make sure that you've retained your skills.
Okay.
Okay, great. Well, thank you so much for coming in today.
Thank you.